Well, Southern New Hampshire Health System is lending a hand to a hospital thousands of miles away in Puerto Rico. Ryder Hospital was devastated by Hurricane Maria, and now Southern New Hampshire Health is collecting essential medical supplies and money to help them rebuild. Joining us live now is Dr. Rob Dorff, Chief Medical Officer for Southern New Hampshire Health, who will actually be traveling to Puerto Rico. Welcome. Thank you so much for being here.
Thanks, Trace.
So we've seen some of the devastation in Puerto Rico. I mean, hospitals really is not a place you want to see that sort of devastation. Can you talk about how this idea came about to help this hospital?
Sure, of course. Actually, one of our physicians, Dr. Melissa Martinez Ordorno, she is from Puerto Rico originally. She has a number of family there, and so since it's such a dramatic humanitarian crisis, she's been providing support there. As a healthcare institution, we wanted to be able to provide like support, looking at the fact that in order to provide long-term support to a community, as well as the providers who provide that health care to people in that community, was of significant importance to us, just given the circumstances in Puerto Rico. In terms of how we decided on Ryder, Ryder is a similar institution to Southern New Hampshire Medical Center, and it has the same purpose of serving the community, and it has been doing for some time. And Dr. Martinez Adorno, as well as a number of us, have been in contact with representatives down there, and we thought that given the location as well as the needs, that would be part of our long view in terms of how we could support a community like our own.
And what is the greatest need there? I mean, we heard the roof torn off and medical supplies destroyed. What do you hope to bring down there to them that's most critical?
We're planning, I think, at least 2 trips down there. The first one is to bring some more necessary small supplies down. They pretty much need everything. Water filtration systems, desks, computers, basic medical supplies. Pretty much everything that was exposed to any of those floors was destroyed during the hurricanes. And so we're just starting small initially, trying to figure out what the community actually needs. We not only want to take care of the hospital, but we also want to take care of those providing the care at that institution, so that many of whom have lost everything, and so that makes it very difficult for them to actually come to work to provide care to others.
Absolutely. And in addition to the medical supplies, I think matching up to $25,000 in donations, that's incredible.
Yes, so we hope to provide again, matching donations, but we also need to bring them stuff that they just can't purchase there. Even if we sent money down, the supplies just don't exist on the island. And unlike here, where if there was a disaster, at least you can purchase supplies or be able to bring in supplies. They're dependent on everything coming from here.
And as a doctor yourself, watching your colleagues thousands of miles away deal with something like this when they should just be focusing on patients, I'm sure is very difficult as well.
It is. I've had the pleasure of and the privilege of spending time with people in Puerto Rico. I had a friend who has family there, and they live very humbly in a lot of places there, and the infrastructure there is very basic. So I feel personally responsible for providing any additional support that we can to that community.
And we have about 10 seconds left, but when do you make your first trip down there?
We are going down on December 15th. There's 4 of us going down, including Dr. Martinez Adorno, my CEO, Michael Rose, and also our multi-specialty group CEO, Susan DeSocio.
Well, Doctor, thank you so much, and for all the wonderful work you do, and good luck in Puerto Rico. If you'd like to help out with the efforts for Ryder Hospital, you can visit this link you see here, right here on your screen. It's www.snhealth.org/PR.